Welcome to our first and possibly last episode of Emilo Sushi Risk Factor Trivia. We've got Sophie here. She's going to be simulating some responses to some questions that are going to help determine her dental risk factor across the decade, represented by the nigiri, representing gum disease. We have the hosomaki, and uramaki is leading up the charge for acid erosion. So let's kick this off. Sophie, the most basic question, how many times a day do you brush?
Just once.
Just once. So we might just sort of tuck you down a little bit there and on the gum disease. Do you floss?
Yeah, 3 times a day.
3 times a day. A bit of stuff there and probably bump down the decay risk. Normal toothpaste or a non-fluoride natural toothpaste?
Charcoal toothpaste.
And that's non-fluoridated charcoal toothpaste?
Yes.
Of course. All right.
Yep.
So you're going to bump up a little bit up there and you're probably going to cop a little bit of acid erosion, but your gum disease might stay the same. How many cans of soft drink would you have in a week?
Well, at least 3 cans a day of Diet Coke.
It puts you like way up the list as far as acid erosion goes. There's no sugar, so it's probably less of an influence on decay. Yeah. And what about lollies and junk food?
Not too much sweet treats.
The big thing is lots of acidic soft drink and no fluoridation in the toothpaste. So that means the risk of acid erosion or the teeth dissolving is very, very high. Decay, obviously there's a little bit of risk there with a non-fluoridated toothpaste, and gum disease with good flossing is probably very low. Thank you, Sophie.
My pleasure. Thanks, Paul.